Hey guys, happy Monday, happy motivational Monday. Hope y'all are doing amazing. All right. Today I want to talk about a question that I get a lot. You know, can you shrink large fibroids? So I want to address that today. All right. Hope you guys are doing great. Hope you guys all had a wonderful, wonderful weekend. So I'm not gonna be on here too long, but I wanted to, if you're watching this on the replay, definitely hashtag replay, and if you have a question, definitely put it in the chat. But yeah, so I wanted to address the question because I get that a lot. Can you shrink large fibroids? I get a lot of women messaging me who have who have currently large fibroids and think that their only option is surgery. And I've also, sorry if you guys hear crying in the background, that's my dog, okay? I've also had, women message me about having large fibroids. I too have dealt with large fibroids before in the past, so I definitely understand, and it definitely can come with a lot of issues, okay? So yeah, but anyway, so you're probably wondering, like, what is considered a large fibroid? Large fibroid is anything over 10 centimeters, okay? And also, if you have multiple fibroids, let's say like they're around 8 centimeters, 9 centimeters, you have multiple, which tends to happen a lot with women, then that's considered having a large fibroid as well, okay? So I posted today, and this is I had made a post today this morning about I think her name is pronounced Marsai Martin, okay? She is an actress, I think she's on Blackish, and she had surgery to remove her ovarian cysts, okay? So she had surgery to remove her ovarian cysts. Unfortunately, she had been dealing with pain for about four and a half years, okay? Sorry, y'all, for the background noise. It's my dog. Trying to tune that out. But anyway, she had been dealing with pain for the past 4.5 years, and she eventually did have surgery to remove it. And she was only 18, so she had been dealing with this since she's probably 14. Who knows how long? And she was saying that how one of the warning signs is having painful periods, having painful cramps, and things like that. That's one of the warning signs of having an ovarian cyst. And I got questions as well in my inbox saying that, can you shrink ovarian cysts? And I was like, absolutely yes. No matter what the situation is, you do not have to resort to surgery, no matter how dire it seems to be, And when you have big fibroids, what happens a lot of times, it comes with, and most times it does come with symptoms. And that's why women are kind of like in I don't want to say desperate mode, but sometimes it really is. They're like kind of desperate to take care of it, whether it's surgery, whether it's FE, like they have so many different options available, but that does not prevent it from coming back. And again, that does not address the root cause. But anyway, let me do a quick intro, and I'm gonna get started on explaining to you guys more about shrinking large fibroids. So my name is Sasha. For those who may not know me, I'm a holistic women wellness coach. What I do is I help women who are struggling with womb health issues. I help them heal their wombs in order, naturally, without using only holistic methods, okay? Utilizing only holistic methods. I help them also engage in everyday healthy habits in order to heal, all right? So my superpower is helping ladies overcome things like fibroids, ovarian cysts, endometriosis, PCOS, as well as infertility. All right, and helping ladies utilize food as medicine and learning how to heal their bodies, okay? Heal their wombs is so important, because when you heal the womb, you heal your body, and your body and your womb is connected. So that's what I do. I've had lots of wonderful clients, and also lots of wonderful past clients who have benefited greatly from my services, who have shrunk their fibroids, overcome infertility, who have regulated their menstrual cycles, who've lost tons of weight, who've rebalanced their hormones, okay? Because that's what it's all about. And, once you rebalance your hormones, that's when your body works the way it's supposed to work, all right? So let's talk about large fibroids, okay? So again, large fibroids is anything over 10 centimeters, okay? So it can range from the size of a grapefruit to the size of a watermelon, okay? So fibroids can get quite large, and when you don't address the issue, when you don't address the issue, they can get quite large, all right? So that's why I'm like, don't ever ignore your fibroids. A lot of times doctors will say, well, if it's not bothering you, just ignore it. You never want to do that, because fibroids do grow, and if it's not bothering you today, then eventually it's going to start bothering you, as they grow, okay? And just to let you know, things that large fibroids can cause in the body, it can cause, infertility. Of course, anemia could cause heavy bleeding. A lot of women that's dealing with large fibroids deal with heavy bleeding, prolonged menstrual cycles that are longer than 4 to 5 days, miscarriages. Unfortunately, they can even get that bad. Hey, Ty, how are you, hon? Having an enlarged uterus, because if you have a fibroid, depending on the location, sometimes it's inside the uterus, it does make the uterus a lot larger. And frequent urination, if it's pressing on your bladder. You can deal with kidney damage as well. Anxiety, depression, because when your hormones are imbalanced, when you have fibroids, of course, your hormones are out of whack. And that can lead to also mood disorders as well, pregnancy complications, because these things are, they respond to estrogen. So when you're pregnant, of course, your hormone levels are higher. So it does tend to grow even bigger fibroids in pregnancy. That's why I tell ladies, before you get pregnant, if you can, let's shrink the fibroids, you know what I mean? Because they grow during pregnancy. Also, blocked tubes as well. They can lead to blocked fallopian tubes, blocking your fallopian tubes. So now I want to say this. No matter what size your fibroid is, they can shrink naturally, okay? I want to say this. It does not matter if they're 2 centimeters. It does not matter if they're 20 centimeters. Now, of course, if the smaller they are, a lot of times, the easier they are to deal with, the easier that they are to shrink, okay? So if you have somebody that has a 20 centimeter fibroid and you have somebody that has a 2 centimeter fibroid, of course, the person that has the 20 centimeter fibroid, of course, it's going to take some more time for them to shrink. But it's, that does not mean that it's going to, that does not mean that they have to go through surgery in order to shrink their fibroids. So, unfortunately, like I said, having large fibroids tend to come with, more bothersome symptoms. They come with more bothersome symptoms. And that's why women are kind of like in a desperate mode. They message me like, can I want to go through surgery to shrink my to get rid of my fibroids because they're bothering me. But I'm like, look, if you commit to a 30 to 60 days of changing your lifestyle and changing your diet, making consistent changes in 30 to 60 days, you will see a huge difference in how you feel. You will see a huge difference in, I'm not saying the fibroids will shrink, but you just see a huge difference in how you feel in your symptoms. Your symptoms will decrease significantly. The heavy bleeding will also decrease as well. And I know this from not just a personal experience, but also from my clients as well. I had a client that was bleeding for 2.5 years. Okay, I can't talk today. Sorry, y'all. That was bleeding for 2.5 years straight. Okay, no breaks, straight for 2.5 years. Okay, heavy bleeding. It was like literally ruining her life. And afterwards, after she found me and I was able to put her on a plan, then literally in 3 weeks, we were able to get the bleeding to come down a lot significantly. And by week 4, her bleeding had stopped. Okay, and this is after bleeding for 2.5 years and going to multiple doctors. And all I did, of course, is put her on, birth control and things that did not help. That made the situation worse. Okay, so it's really important for you to know the right changes to make, because a lot of women will sit here and tell me, oh, well, I just took this herb or I just took this tea, and they expect that to actually work on like a big fibroid or fibroids in general. And I'm like, no, we're dealing with fibrous tissue here. So the healing is a little bit more aggressive, and I hate to use that term, but it is aggressive. Like when you're tackling fibroids, it's a lot, it's a lifestyle change. And I say that for a reason. It's not just, oh, I take one herb and that's, I take one tea and that's it, and the fibroids are gone and my life is going to be, back to normal. That's not how it works. And women get frustrated and they say like, oh, shrinking fibroids does not work because maybe they've tried it that way. They tried it, one of those quick fixes. And like, it's not a quick fix. And even for women, and I know this from experience and I know this from talking to women, even for women that do go to get the surgery, right? And they're like, okay, well, I'm going to start, doing my lifestyle changes as soon as I get out of surgery, as soon as I'm done with the surgery. That tends not to happen. I'm going to be honest with you. That tends not to happen. Are you telling me that after getting out of a surgery bed, you're going to, do a whole lifestyle change? That tends not to happen. Your mind is not even there. You know what I mean? Your mind is just like, okay, your body's trying to heal. You're trying to heal yourself. And then, of course, your symptoms of having the fibroids probably are gone. So your mind is not in the state of I'm doing a whole lifestyle change. It's not there. So a lot of times, even after having surgery, where a lot of women was like, okay, I'm going to start after surgery, that does not tend to happen. Okay. And sometimes fibroids can come back quickly after surgery. That doesn't happen to everybody, but for a lot of women, for me that happened, and for a lot of women I talked to as well, that's happened. Like their fibroids, they've had one surgery already. Fibroids came back quickly and they, you know, plan to have another one. And I'm like, no, I don't recommend that. Of course you can do what you want, but I don't recommend it. I recommend you, let's start changing lifestyle. Let's start making these changes. Let's start, you know, detoxing your organs. Let's start rebalancing your hormones. Let's start flooding your diet with, you know, key nutrients and, you know, taking care of your mineral deficiencies. And it's a process. It's a long process. And like I said, I have a 12-step process on how to shrink your fibroids. It's not going to happen overnight. You know, it's something that you have to commit to. And then it's not just, you know, some women think it's just change your diet or it's just, you know, take out meat out your diet. If it was that easy, 90% of Black women would not be struggling with fibroids. If it was that easy, okay? It is a lot. There's a lot more to it than that. I always say that with fibroids, people look at it, you know, as surface level. And I'm like, no, it's more to it than that, than fibroids. Like, it's more to it than, you know, just changing a couple of things and that's it. Like, you have to really think about, okay, what developed the fibroids, you know what I mean? I mean, we're talking about from things from, you know, trauma in the past and not dealing with that and holding on to that to, you know, my diet, accumulation of a bad diet to, you know, clogged up elimination pathways. It's deeper than just, oh, I just got to take out meat from my diet and now everything's going to be okay. Or I'm just going to take this one herb, everything's going to be okay. It's a lot deeper than that, okay? So you cannot think surface level when it comes to shrinking your fibroids. It's not surface level. And that's why a lot of women will say, well, it doesn't work. I'm like, you have not done it the right way. Number one, you have not done it consistently. Number two, that's another thing, not being consistent. Hey, Jay. Hey, y'all. Ty says everyone should buy the 12-step process to shrink your fibroids. It's amazing. Thank you, Ty. Yes, I do have a 12-step process on how to shrink your fibroid course, ladies. If you need that, get it, because it's going to literally show you step by step. I'm telling you step by step how to get rid of your fibroids, how to shrink your fibroids. Okay, so you're not over here. I'm buying this tea. I'm buying this herb. No, that's not. Number one, you're not being consistent. You just kind of like all over the place, and I know that for a fact because I used to do that too as well. Oh, I'm buying this tea. I'm buying this herb. Let me Google see what's going to help. Oh, maybe this vitamin will help. Maybe this and all this bad advice. No, like. You need a consistent plan. You actually, like I said, it's not just surface level. It's not, you're literally healing your body. You're getting your body back into balance because your body, you know, is off balance when you're dealing with fibroids. Your liver is clogged up. You're dealing with a congested liver. Your lymphatic system is congested. You're dealing with a lot when you have fibroids. You have a ton of waste. You know, your gut health is poor. You know, you most more than likely have low vitamin D. You're anemic. It's more than just, you know, oh, I'm just going to take out meat, or I'm just going to take this one herb. It's more than that, okay? It's more than that. So, of course, when you're dealing with large fibroids, you got to be a little bit more aggressive, but they can heal. I had a client that she had a huge fibroid, and it was literally pressing against her stomach and making her look, you know, making her stomach look pregnant, unfortunately. So in 6 weeks of us changing her diet, she felt a significant difference. She's like, I don't feel that big bulge in my lower belly anymore. Like, I feel I'm not running to the bathroom every 5 minutes anymore. Like, you know, I feel so much better. Like, I have more energy. Her anemia, we healed her anemia with those 6 weeks. And now, even after the program, she's doing amazing. You know, her fibroids right now are in the state of shrinking, okay? And I cannot wait till she goes to the ultrasound to go get another ultrasound, to see how far they've shrunk, okay? And she was going to do surgery before she came to my program, but guess what? She knows that she no longer has to do that. You know what I mean? I equipped her with everything she needs to know to shrink her fibroids, and she feels great. And she was like, you know, desperation when she came to me. Okay, so I want you to know that your fibroids can shrink. You do not have to go through surgery because guess what? What happens, you're not taking care of the root cause of the problem. What's the root cause of the problem? You're not taking care of that when you're dealing with surgery. You're literally just cutting into your uterus, taking out the fibroid, causing scar tissue in your uterus, causing, you know, more issues. Okay, and I tell people, and how many myomectomies is too much? Because there's women that's done myomectomy, already had 2 or 3. So how many is too much? And when they can convince you to continuously have surgery, then they easily can convince you later on to have a hysterectomy. Because eventually you're going to get tired of having, you know, multiple myomectomies and not seeing long-term relief. instead of doing the hard work, I understand that it's difficult, but it can be done doing the work and actually healing it from the root and continue on that lifestyle so you don't have to worry about it continuously coming back. And remember, and I talk about estrogen dominance, and I want to do a whole video training on estrogen dominance because that's one of the top causes of fibroids. And it can manifest, if it's not fibroids, like let's say you have a hysterectomy, it can manifest into something else, such as uterine cancer, which, the rates are going up, such as breast cancer. You're not taking care of the root problem. So when you're not taking care of the root problem, what can happen is these things can manifest into something else that's even worse than fibroids. Okay, I know a client that took out her fibroids and they got endometriosis because she didn't take care of the root problem at first, but now she's in my program, she's healing. So I say all that to say, yes, you can shrink your large fibroids. I do not recommend that you go through surgery and think that, okay, right after surgery, right after I get off that table, I'm going to be focused on, shrinking my fibroids. I'm going to be focused on making these lifestyle changes. Typically, it does not work like that. I'm gonna be honest with you. You're not thinking that far when you talk about healing your fibroids. When you talk about a surgery, you're not thinking about, okay, as soon as I get off that hospital bed, I'm gonna start going through the process of changing my lifestyle, changing my fibroids, and changing my diet. You're trying to heal your body. You're trying to walk again. You're trying to that surgery, man. It's very difficult surgery. So don't think that, okay, after I'm going to just do surgery to get this out real quick to, minimize these symptoms. And then afterwards, I'm going to change my lifestyle. Typically, it does not work like that. I'm going to be honest with you. I have not seen, for the most part, it does not work like that. They tend to continue to kind of struggle with, symptoms, or even, maybe they don't have those symptoms they had initially, but they tend to still kind of struggle with changing their lifestyle even after the surgery. So I say, honestly, before you go through surgery, at least take out about 3 months of really getting clear, really, a real plan on shrinking your fibroids, not just, oh, I'm going to just take this herb here, I'm going to take this tea here. No, a real plan where you're actually detoxing your body, you're rebalancing your hormones, you're flooding your body with nutrients, okay? A real plan, okay? So for those that need more help with shrinking their fibroids, I am here. We're about to be in 2023 in 20 days, okay? We got to stop actually putting ourselves last and putting our health last as Black women. That's why we deal with all these issues that we deal with, to be honest with you. So I do have a 12 steps on how to shrink your fibroids for those that are interested in really shrinking their fibroids, okay? I have that course that you can take on your own. I also have where you can work with me one-on-one in shrinking your fibroids, where I'm literally helping you along the way, do the hard work of changing your lifestyle and changing your diet. I'm literally taking your hand through it and helping you, giving you all the resources for you to be successful in doing that, okay? And when I'm taking you on as a client, I make sure that you are successful, in healing in your womb. I equip you with all the resources, and of course, I do the weekly calls. But anyway, so for those that are interested, send me a message. If you go to the link in my caption, I do have my 12 steps on how to shrink your fibroids course. If you're interested in that, if you want to look, Sasha, I want to work with you one-on-one, okay, for at least 16 weeks on really shrinking my fibroids. Then message me, okay? Let me get you in a 12-week transformation program because it's now 16 weeks. All right, and let's really get on a plan to shrink your fibroids for 2023. Okay, so you don't have to go another year going through all these issues. Okay. Off topic, this lip color, yes, ma'am. Thank you, Ty. Thank you, Ty. But yes, so I really want more and more women to know that their bodies can heal. Your bodies are self-healing. Your fibroids can shrink. Okay, don't let anybody tell you that they cannot shrink and it's impossible for them to shrink. And no. Have you? And for those people that say that, I'm gonna ask them: have you tried it? Have you tried it? Consistently for a good number of days? Have you tried to shrink your fibroids? Okay, because I've tried it the surgery way. Okay, that didn't work because they came right back. And I've tried it the holistic way, and that worked. Okay, that worked. So I challenge for people that are saying that you can't shrink your fibroids. Have you tried it consistently for at least 6 months? Consistently, not just here and there. Consistently. Most of the times it's no, they haven't. So they shouldn't even comment on it. Okay, because they don't know what they're talking about. It does work. These are tumors that can shrink. I don't care what nobody says, okay? The human body is amazing. Stop doubting yourself. Stop doubting your body, all right? But anyway, guys, I do have to go, but I say all that to say, yes, you can shrink your large fibroids. And make sure you guys share this live as well. Share this live because I know multiple women have large fibroids, and Especially black women tend to have larger fibroids and tend to have more aggressive fibroids than any other race of women. So go ahead and share this live as well so more black women can see that, okay? So anyway, I say all that to, this dog is running around, sorry y'all. But anyway, I say all that to say that if you want to work with me in shrinking your fibroids, getting rid of your fibroids, healing your womb, okay, so that you don't have to continuously, battle with these big tumors, and you don't have to continuously worry about them reoccurring back to back. Like, that's frustrating and that's very depressing. And I know, because I've been there. Go ahead and send me a message, send me a DM, okay, if you want to work with me. If you want to get my 12 steps on how to shrink your fibroids, y'all heard Ty said it's amazing, okay, and I've gotten amazing reviews from it, then definitely click the link in my caption, www.sasharose.com, okay, get your how to shrink your fibroids course, my 12 steps, okay? That's literally going to tell you, and it's like you're gonna see how shrinking your fibroids is not surface level. It goes deep, okay? So it comes with a meal plan, and also comes with a what else? It comes with a grocery shopping list as well, okay, to help you along your journey. All right. So that's pretty much it. I love you guys. Hope that you guys have a wonderful rest of your Monday. I do have to go, but I didn't want this to be a long live, but I want to empower you to let you know that your fibroids can shrink, okay? But you got to stop doing the things that you were doing before. And this is one thing too. Get off the birth control, y'all. Get off the birth control, because how can you have fibroids and you on birth control? You literally making it worse. You're making your situation worse. And a lot of people are on birth control because to manage their fibroid symptoms, but you're making it worse. You're flooding your body with synthetic hormones. Okay. That's going to make your fibroids grow, make your symptoms worse. And you may not see it in the, you may not see what you're doing to your body right now, because, your hormones are being suppressed. Your natural hormones are being suppressed while you're on birth control, but eventually it's going to catch up with you. Okay. So let's get off the birth control. Let's stop flooding our bodies with synthetic hormones, because that's what makes it worse. Let's get off, the hair relaxers as well. I talked about that earlier this week. The hair relaxers as well. Hopefully nobody's doing that. You got to start removing these hormonal things from your diet, from your the products as well, because all that contributes to fibroid, and they contribute to the development of fibroids and fibroid growth as well. Okay, so in case you did not know, it's a lot more to it, but I just want to tell you guys that, because I'm meeting a lot of women that's on birth control. They're on birth control and they have fibroids, and I'm like, no, you're working backwards here. Come on now, you're making things 10 times worse. Okay, all right, but that's it. Love you guys. Make sure you guys, for those that just coming in, make sure you guys rewatch the live, share the live. All right, and I'll talk to you guys later. Bye.